I'm talking to Kristen Donescki. She is the program director at North Shore Health Project. Kristen, can you talk to us about the North Shore Health Project and how it serves our community?
Sure, I would love to. Good morning. So I work here as the program manager for the One Stop Harm Reduction Center, which is under the umbrella of the North Shore Health Project. And we work with people who inject drugs, any sort of drugs, and use opioids. And we provide needle exchange services to stop the transmission of HIV and hepatitis C. We also offer hepatitis C treatment options, linkage to care, and we really work with people around their health in a holistic way at any stage. If they're actively using drugs, if they're in self-identified recovery, a lot of times people will return to us for our services at different stages of their life and of their drug use. And so we offer HIV testing, hepatitis C testing, and also STI testing here. And that's not just for our members, but for the general community as well. Anyone that feels like they're at risk can come in and get tested and get their results within 3 to 5 days. And we're able to do some counseling with people around safer sexual health practices. If people are doing, our sex workers, we are able to talk to them about keeping themselves safe and the work that they do. We're also able to connect people to PEP and PrEP. So if somebody has had an exposure, we're able to make a quick referral and work alongside them to make sure that they can get to the ER to get PEP, which in the window of 72 hours can help stop the transmission of HIV if they've been exposed. And we can also get people on PrEP, which is a daily pill that you take that most people know about, really regarding in the gay community and men who have sex with men, but it actually is for everyone, and it's a really amazing pill that everyone can take once a day to help stop the transmission of HIV, especially if they're having different partners or they feel that they might be at sexual health risk. It's a really great safety tool for people to have. The same with condoms, but we know a lot of times people don't use those, so it's great to have another option and to be able to talk to people about their health and how to stay safe. So those are some of the things we do. In more practice around harm reduction counseling, it often gets attached to drug use, but it can really open up into everything. So whatever behaviors in people's lives that seem to be getting chaotic, we can talk to people about how they can reduce the harm in some of those behaviors. That doesn't necessarily mean stopping the behaviors, but how they can stay safe if some of them are working for them in some ways. And we know that's true for most humans. The other part of our project, we talk to people about wound care, safe injection. A lot of times people will start injecting drugs and not know how to do it, never have had any education around that, and that can cause a lot of health complications. So we're able to talk to people about safety around that. And then just celebrating and creating a community for any positive change. So for any space where people can make some positive change in their life, we really want to create a safe space for people to feel like they can trust us and come in and really see us as their safe space. It's really their space. And so we try to really make sure that we send that message. And on the side for the North Shore Health Project, they work with people who are HIV positive. So we do a lot of have shared community members, do a lot of work together, and hopefully in the future, following COVID, we'll be able to reopen a lot of our groups. They offer holistic services to their participants and our participants who are involved in getting treatment, which is really beautiful because side by side we can offer people to make a choice for their health, and at the same time providing them like a different holistic view of their health too, like acupuncture and being able to do the cranial sacrum work and just a lot of things that people probably wouldn't have access to. So that's one of my favorite things about working here and being able to talk to people about ways that they can take care of themselves. And that really starts a practice for them. You can see how excited people will get about just a new way to take care of themselves that no one's really shared with them before. So there's counseling and case management that goes along with the HIV positive side of, and we have Brian and Jason who do that work. And they also do continuum of care work for people that are living with hepatitis C that have cleared, that we've been able to connect to treatment. I won't go too far into it, but that's also just a pill, which is a really amazing pill right now. We have a few forms of it. That's 8 to 12 weeks once a day, and people can be completely cleared of their hepatitis C. And so that's something that we really try, and Mass Health will pay for it. Most insurances cover it. So that's really something we try to promote people to do at whatever stage they're at, because sometimes, talking to people in the counseling, harm reduction counseling around, we don't know always, and just in general, we don't know how things affect us until we address them. And then all of a sudden we feel so much better, and we haven't really connected those two things. So that's a lot of the work. We work together with shared community members there. And then the other things that we do here in our community at One Stop is we get people connected to methadone and Suboxone, to the clinics here in town, and clinics wherever they, seem like they're going to feel the safest, and feel the most connected. So a lot of that can be around transportation, and we offer sort of appointment accompaniments when we can to PCP. We're doing a lot of telehealth calls right now, which is really great to see. So a lot of times people who inject drugs or use drugs have a lot of fear going to the ER or going to their doctors around stigma, around maybe just being treated really poorly one time, and it creates, there's a lot of internal shame, as you know, so it creates just a huge barrier to go get healthcare. And so being able, what we've noticed is being able to do this over the phone is actually, we weren't really sure how it would go, but it's actually been really fruitful. People feel safer. They don't have to leave their homes. We've gotten people on antibiotics and things that probably they wouldn't have access to if telemedicine wasn't part of it. We're also able to offer Suboxone over the phone, intakes that way, so people can make choices about their health. And I'm hoping that continues into the future after COVID as well, because I think that would make a huge impact. And the other things that we can get people connected to is detox, of course, and longer term treatment. We're starting to really bridge the gap around behavioral health, and that would be something that I would really love to see start to grow here as well. But we do some of those referrals. So I think oftentimes people will hear the term needle exchange or overdose prevention, and kind of really just peg it into one kind of service. And we know that human beings are so layered, right? There's so many things that are going on, and why people use drugs to cope with things. So we try to kind of reach people wherever they are and whatever they need. Most of the time, it's a lot easier for someone to talk about a health need than to jump right in with their drug use. And so, we were talking about this the other day. We have a lot of conversations where people aren't really wanting to share that, even at a needle exchange, because the stigma is so heavy. So getting to know someone, building the relationship, just like in any other service, and then some of those things start to unravel. And then, of course, Narcan, overdose prevention. So we offer overdose prevention trainings and safety planning to the community members, to loved ones, to anyone who has anybody in their life who might be at risk of an overdose from opioids. And I think that there's, without knowing too much, when you hear overdose prevention or Narcan training, you think it's just generally about how to administer the Narcan. And that's a huge part of it. But also it's really an open dialogue about safety and awareness, and what the signs are, what to look for to support someone that you love, how to have those conversations, which are very hard to have when it's someone you love. And then the support kind of after an overdose occurs, the risk factors. So it's a lot more of a compounded training than just, something you might see on a flyer. So when we talk about our community trainings, a lot of times I think it just creates a safe space for people to talk about what they're experiencing. And then we obviously get into how to administer the Narcan if an overdose happens. But, there's not a lot of safe spaces to talk about drug use, to talk about preventing an overdose, or your own fears of someone you love maybe overdosing. For lots of people that don't have any education, drug education, and they have someone in their life, it's terrifying because they don't know, any sort of risk factor. And obviously we love people, we want to keep them safe, and we go to the worst case scenario, and that can create, more harm sometimes. So we do a lot of kind of that balancing with family members too. And we've started to do some follow-ups with first responders for overdoses. So we're hoping that that expands as well. So we work with part-time right now with Beverly PD and Ipswich, the recovery coach there. So when an overdose occurs in their community, they can share the information that they get, they can share with us, so we're able to connect with family members with them, supply Narcan, train the drug user or the family member there, and also do some mediation around what their resources are. And it doesn't always have to be that people want to go to treatment right away, but if they have that information, sometimes they'll call months later or weeks later to kind of access when they're ready, which we really believe is the way things work. When people are ready to make that positive change, they will. And we can't really, there's a Andy Warhol quote, like, we can't stop people we can't make people make that change, and then we can't stop them when they're ready to make that change, which I really agree with. And so we really just wait for people to come to us when they're ready, and hopefully if we do a good job, they know where we are and that they can come to us. Yeah, so that's a lot about our programming. Sorry.
No, it just emphasizes the value of the work you are doing, and it sounds as if all those services must be so harshly impacted by the COVID-19 restrictions on social interactions. But I'll just add to that, and you can emphasize this too. It sounds like the telemedicine is at least a good thing coming out of it, that you're able to reach people maybe even more distinctly and more extensively through telemedicine. But let's talk about access. Like, immediately, my first question is, let's say there's a family out there and they're brand new to this whole experience and they just had a crisis. How do they find you?
Right. So hopefully, we have social media access. So we are on Facebook. We're offering virtual community overdose prevention trainings right now, which is, the same as Zoom, but people could come on and be anonymous or change their name or do whatever is going to make them feel safe to come to the training. We have another social media outlet of Instagram. We do have palm cards that we try to distribute, and we have an outreach cell phone number that we posted up with our primary focus around Gloucester and Cape Ann. But I'll hold our little palm card up, but it looks like this, and it has our services on it, our hours, our phone number, all of those things. And most of that is getting it out to community members, and then also the drug using community. So I talked a lot to families about just taking one of these to have, to have around their house, just so that it could spark a conversation. It could be a hard conversation at first as to why do you have this palm card, but people kind of reaching out that way. We also work closely with Learn to Cope here, and some other harm reduction agencies. So we're able, hopefully, to try to get at the very least, our information out. And I've talked to a lot of family members who have said, I came by, I felt weird, I didn't want to come in. And so hoping that the phone, like the cell phone number that we have, which is easy access, might be a way for people to reach out and feel safe at first. And it can be difficult as a family member, especially in a smaller place like Gloucester. I've done a lot of work in Cambridge and Boston, so it's a change to work in a really tight-knit community, a really great change, but it's sometimes different challenges come up, and I think people feel nervous to come in because someone might see them. Right now that's different, but so I think, and we get that from our participants as well. Sometimes we're meeting people and doing deliveries right now, which again I think will continue on after COVID. We've implemented that as an intervention during COVID, but I think people are really liking the delivery service, so I think that will continue. But I think to answer your question,
when you say you're delivering Suboxone and Narcan, is that what?
So yeah, so we're delivering supplies to people. So new syringes, new any sort of equipment that they need to make sure that they're using new supplies each time. We're really concerned about people sharing equipment right now because of limited access to services, which could, as we know, could increase the risk of HIV or hepatitis C. So we're trying to really make sure people take a bulk amount, take more than they usually would take, especially we have a lot of people who come in to get supplies for other people. So we call those people secondary exchangers. And so what they do is they'll be the one kind of like going to get a coffee for everyone in the office. They're the one that goes to get all of the supplies to bring back, and then share with everyone. So we're trying to make sure that they have everything. And then Narcan is included in that. Suboxone has to be prescribed through a doctor. So I would love if we could be giving that and offering that to people, but we're not there yet. So hopefully one day. But right now we work with Dr. Slocum and some other doctors in the local area through the North Shore Health Project, North Shore Community Health, and to get in the clinics up here to make sure people can get their Suboxone. It's a little trickier right now. We've been working with the methadone clinic as well, trying to limit the amount of people that have to present at the clinic every day because of exposure, risk for exposure, and people are really scared. It's also bringing up a lot of, I don't want to speak for them, but from what I've gathered, a lot of emotions around feeling, why am I still required to come here every day and somebody else is getting their methadone at home? And so it's creating a lot of kind of re-stigmatizing feelings within the community. And there's a multitude of reasons, and I think the clinic's doing the best they can to try to limit people having to be around each other. But that's something that we've really been faced with and talking to a lot of people that have returned to street drug use because of their access issues at the clinic, which can lead to overdose risks. So we're hearing, the more we hear things, the more COVID's really changing the face of the risk factors. And so trying to do risk assessments with people in the moment, and then seeing people come back to us, it's always great to see them, but it also means that they're returning to use maybe after a while of not using, and that can put them really at risk. So we also supply test strips, which are a tool for people to test their fentanyl. And there's strips that we have worked with PARI through Ipswich and Beverly, and we've also had some of our own, but they're strips that people can take to test their drugs. So if they're primarily stimulant users, they can test their drugs to see if there's any fentanyl in them, and then readjust how they might use according to that. And so that's a really helpful tool right now because we know a lot of overdoses are happening. I don't know if I answered your question, Heather, I'm sorry.
No, you did, and you said more too. So, so basically, you're seeing this population, this community, being much more affected by the COVID in terms of stress and returning to habits. And you're feeling, are you as an organization feeling stressed beyond your abilities? How are you feeling?
I think it's an emotional exhaustion, worriment, more than we're doing our regular business as usual, and actually feeling like we're doing less, which is I think can take a toll. And then also knowing what our community and people we care about are holding right now.
Mm-hmm.
We're just, I think last week, we had a few people just come in and really, I think we're like three weeks to a month, right? And so people, I think at first it was like, okay, we can do this, we can handle this, I've got a plan, my routine. And now people's mental health and lack of access and lack of control over their own lives, I think right now, for people who use drugs in that community already feel that way very much so every day. And so this has just amplified that. And it's real sorrow. It's real sorrow. So it's hard to hold that. And I've been doing this work for a long time, and we hear a lot of that and hold a lot of that. But for some reason, over the last few weeks, it's been extra to hold because we just don't have, the shelters are not taking new people in for safety reasons. There's just not a lot of resources to offer people. And we're getting calls from places where we go to do Narcan trainings. This was another thing that we do that I didn't mention, but we go to offsite, to residential homes, to treatment centers to do our prevention trainings. And we're getting calls from them with an increased overdoses happening at their sites.
Mm-hmm.
So we're dropping Narcan off, but you can't
do
for them, and we can't reach them. And that's, for me personally, I can see that I've altered the way that I do the work. A mom that I see that normally I would hug and say, I can't, this has been so much you've gone through, and get Narcan to, we can't do that right now. So I think everyone's feeling, all of us are feeling that in the world. But I think for a community that's been in real immeasurable grief for a long time because of the impact of the overdoses and the epidemic, we now have layered on the pandemic. And I think there might be a piece of feeling like they're going to be forgotten about. Like, overdoses are not going away during this pandemic. If anything, they're increasing. And so, and people are also isolated with their family members or with stressors that they normally, for all of us, but normally, people are doing the best they can, but I think it's causing a lot of risks that maybe don't usually exist for all of us. Yeah.
Right.
Yeah.
So just to be clear, how many of your services, or which services are actually still open for people? Like, how many of your doors are open? The methadone clinics are open. What kind of behavioral health are you able to do? Is your actual door open for people to walk in? So could you just go over that for us?
So we're doing, One Stop is doing, the Harm Reduction Center is doing takeout, we're calling it, from 9 to 5, Monday through Friday. And then we also have our outreach phones on and are doing deliveries during that time. And we do deliveries until 6 o'clock. And we rarely do the evening deliveries. We rarely get calls, but we do sometimes. Mostly those hours existed when people were working. And a lot of people are staying home right now. So we're getting some different folks. And then we also are able to do outreach. So we're out doing set outreach on certain days, certain hours, and we let people know that we'll be out in the community, and then trying to spread those outreach hours throughout Cape Ann, in Essex County, just so that people that don't have access to getting to us or don't have access to a phone. So those two things are barriers sometimes. Most of our community members have a phone or have somebody in their life who has a phone that they can call us. We also created a mailing list of people, so we make sure we text everybody every week. Luckily, we're small enough to do that, and we do check-ins, and we just want to talk to people to see how they're doing. And I think that's been really telling too, that sometimes people don't need supplies, but they're texting us photos and calling us and just need some sort of connection. So those are kind of our hours. And then our trainings that we do, we can mail supplies and Narcan to people as well, but it's usually drug users don't really want things mailed to them in that way unless they have real access issues. But loved ones and family members, if we do a training with them, we can mail out the Narcan so they don't need to come. We've been trying to work with the Fisherman Partnership and the Fisherman's Wives Partnership up here to be able to provide Narcan to them. If there's drop-offs, just make sure that we're getting it to the families. If anybody needed that up here, we've done some trainings with them in the past. So anything that people need, we're really flexible right now. And as far as I'm concerned, I'd rather just flood everybody with Narcan so they have a kit and they just know they have it on access, rather than not, because when it gets quiet, that's the concerning time. As far as behavioral health and the clinics are open and dosing. I believe, and they can probably speak better than me about this in case hours have changed, but I believe it's Monday through Friday, 5:30 to 9:30 in the morning. So that's when people go to get their dose, if they're still doing that. A lot of people, I think more than half of the people are getting take homes right now. which means they get their doses in a lockbox and are able to take it a 30-day, and sometimes that looks different for different people. But the federal guidelines were lifted for that, so it's up to the medical directors at the clinics, but the federal guidelines were lifted during COVID that people could get their take-homes for 14 days or 30 days, so they didn't have to go to the clinic. And then as far as behavioral health, we haven't made many referrals, but I did talk to the doctors at North Shore Community Health. Sorry, I always mix them up, and I'm new up here, so I'm like, don't say it, don't say it wrong. To be able to do that telemedicine. So as far as I know, they're taking new intakes. They can do it over the phone, and the same with our Suboxone referrals. So what we're trying to do is we created a little resource. So people know and they have the numbers, and if they don't have a phone, we can meet them, use our outreach phone to call with them. And there's also BMC, Boston Medical Center, is doing it, and their doctors are able to reach, like, I've been told that they can do it for us out here in Gloucester, so I haven't tested that yet, but I think I haven't had to. But I think that there's a lot of people, a lot of doctors right now really stepping up to try to get people what they need. So that's been great. Yeah. But behavioral health services is always something I think that often goes unaddressed and is a hard one for all of us to connect to. So I think even right now, connecting some of the anxiety and stress and depression and all of the things that make people try to self-medicate, it seems probably very legitimate, or that it would be easier to go and self-medicate than to access a therapist or a clinician right now. But we'll do our best to try to get that message out that there is access. So, yeah.
And that's the North Shore Community Health.
Yes. Yeah.
And
I think that there's other places doing it as well. I don't know about the same day, but yeah.
So could you just say the phone number for One Stop, that the main number, so that it's in our interview?
Sure. So the outreach number is 978-381-3170. And you can call or text and leave a message if for some reason we don't answer, but there's 2 of us now, usually 3 of us, that have that number on, so we should be able to answer your call. And then the main number for the actual exchange is 978-865-3924.
Great. And is there anything that North Shore Community Health is asking of the larger community? Are you looking for donations? What kind of support might you need?
Yeah, so people have been really wonderful and brought tents and sleeping bags. We could always use donations of socks. We have a lot of hygiene products right now, which is great. We've had really wonderful people make masks and donate masks for our participants, and that's something that we're running low on now, being able to give people their own masks. Especially, I know that in Gloucester it's been stated for a while, but now everywhere on Wednesday we're going to need to have a mask wherever we go. So that's, I think, something that's really important for people. And I can't really think of anything. I mean, food supplies and things like that, we're doing okay. I think because we don't have people in our drop-in center, which is the harder part right now. But anything that people can think of that they might have around the house that are extra blankets, anything that they, would usually donate to Goodwill or somewhere else. Mm-hmm. If they're clean and they're okay, we can even work on trying to clean them ourselves. But we have some people that do sleep outside. And as the weather changes, probably more people will start to do that. So being able to supply people with tarps, tents, sleeping bags, anything like that would be appreciated. And we also, just so people know too, we also share resources with Healthy Streets in Lynn for sort of our North Shore folks. Mm-hmm. So, even right now they're seeing a higher number of people right now, I believe. And so we're able to share resources so they wouldn't go to waste, even if we didn't have people to give them to right away here. Yeah.
And they can drop them off at your offices downtown? Where should they go?
So 9 Center Street is the exchange door, and then we have the North Shore Health Project is 5. So Either side is fine. Yeah.
Great. So anything else we should know, Kristen? This is such important work you're doing. Thank you so much.
Oh, no, thank you. And I appreciate you having me on and being able to talk about the work sometimes too. So it's helpful to me too to hear that we're doing some things, because it feels right now like it's really hard. So I really appreciate it. Thank you.
Sounds so important. So thank you, and come back and talk to us again and let us know how the community is doing. Okay.
Okay, great. Thank you. Stay safe.
Take
Thanks.
care.